Hello, everybody. In this speech, I will inform you of the reasons why nursing is very important. William Osler once said, "The trained nurse has become one of the greatest blessings of humanity, taking a place beside the physician and the priest." Also, Santa Monica College says, overall, nurses can assess patients' health problems and needs, develop and implement nursing care plans, and maintain medical records. Nurses administer care to the ill, injured, recovering, or disabled patients. They also advise patients on health maintenance and disease prevention, or provide case management. As a CNA at the Stafford County Hospital, I work alongside of many different nurses. I also do job trials with different nurses to figure out what specialty interests me most. For example, a couple months ago, I went to Hutchinson and I followed a labor and delivery nurse. So nurses are important for helping people find what degree they want to go into or specialty, and it was very fun, and so that's another reason they are very important. Because nurses have such high qualifications, they regularly save lives and are an essential part of the medical profession. Nursing is a very important career, and I believe that everybody should learn about nursing because nurses are the ones going to be taking care of you. For an example, most of you have probably been to a clinic or hospital, and the nurses are the ones to gather your information and to give it to the doctors. From there, the doctors will diagnose you. After that, the nurses will be the ones to treat you and take care of you and make sure you are comfortable. So since they're taking care of you, you guys should all learn about them and why it is important. Also, to help understand inner working of your healthcare. Now let's take a look at what nurses have to complete before they're even allowed to touch the patient. Before a nurse is allowed to perform the most unexciting task, he or she must be trained, certified, and highly qualified. Doing these things is no easy task. JHI staff says, training covers everything from best practices in routine care to intensive care to patient safety and all sorts of specialty care. So there are a lot of hoops one must jump through before the first day at a hospital. In addition to a large amount of training, nurses requires years of schooling. There are many different types of schooling. There is an associate's degree, a bachelor's degree, and a master's degree. An associate's degree is a 2-year program, normally at a community college. A bachelor's degree is a 4-year program, and you can start out at a community college and transfer, or do all 4 years at a university or private institution. And lastly, a master's degree is a 6-year program. While doctors are trained, qualified, and capable, nurses are the ones that do the work that doctors do not want to do or do not have time to do in order to save lives. Because doctors have to juggle so many patients, nurses spend more time with the patients than the doctors do. Nurses get to know the patients and learn their pain levels, their life stories, relationship histories, and flat out understand the patient better. When a doctor comes and talks to a patient, on the other hand, they only talk to the patients for about 2 minutes. So nurses spend hours and days with patients, making sure the patients are comfortable. So nurses are the real doctors of the hospital because they care for the patients as a part of their own family and make sure they have everything they need. The difference between nurses and doctors is that doctors confirm a diagnosis while nurses are the people to treat that diagnosis. While doctors are staring into their pagers, the nurses are the people getting to know the patients and saving their lives, which makes nurses an essential part of the hospital. Nurses need to get to know their patients for a variety of reasons. There are so many reasons. But one reason is it's to learn the person's personality. If the patient does not know the patient's regular behavior, the nurse cannot know if the patient is acting differently after being placed on new medication or just coming out of a procedure. Also, getting to know the patient personally takes time, which is why with the 2 minutes they spend with each patient, doctors are incapable of performing this task. If the patients are acting differently, it normally means things have gone worse or better. Another reason is if the patient is comfortable, they are most likely to be truthful. For an example, if the person is a smoker and the doctor and nurse do not know that, and the patient is having breathing problems or lung problems, so the doctor is trying to diagnose and treat the patient, and they don't have that information, so it could mess it up or mess with the patient. But if the nurse makes the patient feel comfortable and at home, then he or she will tell the nurse, oh hey, by the way, I am a smoker, and then the nurse can tell the doctor, and it can open up many new doors and opportunities and help that patient even more. And they use the knowledge to figure out why something happened and to fix it before the doctor puts on new medication or diagnoses something completely wrong. Nurses save lives because they get to know every detail about their patient. And also, since the nurses know everything about the patient, when the doctor comes in, the nurse is the one to give the information to the doctor. So if the nurse knows everything about it, she can say, or he can say, hey, he's acting differently, I think it's the new medication, and they can switch it up, so it really helps the doctor too. In conclusion, overall, doctors and nurses have the same goal, and it's to save people's lives, to take care of them, and to make sure they are comfortable, and so that's why they are both very important. Doctors and nurses have to work as a team. While the doctor orders the medicine, the nurse is the one to give the medicine and make sure it's the right dosage and make sure that the patient actually is taking the medicine. While the doctors are there for only 2 minutes, like I said earlier, to give good news or give bad news, the nurse is there during and after, either holding hands or comforting them or even celebrating if it's good news. And this is why the nurses are the heart of the hospital, because they care about their patients' safety, care, and health. And this is why my future career in nursing is very important. Thank you all for listening.